To understand, hepatitis means inflammation of the liver. The word itis at the end means the liver is getting inflamed. So there can be multiple reasons for it. The most common in children is because of viral infections. The most common viral infection is hepatitis A, followed by hepatitis E. Now, between these two, hepatitis A is a vaccine preventable disease. 2 doses of vaccine of one specific type and 1 dose of another vaccine will give a lifelong immunity to the children who gets vaccinated for hepatitis A. There is no vaccine for hepatitis E. Apart from A and E, there is two more viruses, which is hepatitis B and hepatitis C. Why do we club B and C together? Because the mode of transmission is through blood contamination. And in children, they usually get it when the mother's is affected and they get it through the mother's womb. Now, how will these children affected with any of these hepatitis present? They will present with jaundice, which is seen as yellowish discoloration of the eyes, yellowish discoloration of the urine. In common language, it is called as high colored urine. Other features are vomiting, recurrent in nature, not subsiding, not improving, associated with decreased oral intake, and also associated with abdominal distension and abdominal pain. On examination, if any of the children have hepatitis, the doctor can identify that the liver is enlarged or the liver is even shrunken in later stages. When we do the blood test, the liver function test, which is commonly called as the LFT, that is deranged. There are different parameters of LFT like total bilirubin, direct bilirubin, SGOT, SGPT. So all of them will be deranged. And hence we will find that the child has hepatitis. If any of the child who has hepatitis undergoes an ultrasound, so they will have abnormalities of the liver in the form of size, shape, sometimes fluid in the abdomen, and enlargement of the liver. So all these changes are what is called as the different signs of hepatitis in children. Apart from the viral hepatitis that we discussed, A, B, C, and E, there are other diseases of the liver which are not viral in nature, but they do cause hepatitis. The most common of it is autoimmune hepatitis, in which the body itself produces some chemicals or some cells which go and disturb the liver of the self. So the body has an autoimmunity to one's own liver. This is also a very common cause of hepatitis in children in India and as well as around the world. One more important disease which I feel is very worth mentioning here is Wilson's disease. Now, Wilson's disease, unfortunately, is in maximum number of cases are seen in India as compared to the rest of the world. That is because of our genetic makeup. Now, Wilson's disease is a disease of copper overload in the body. For some reason, because of a genetic disease, of a genetic abnormality, the copper which we consume in the diet, in a routine diet, does not get detoxified appropriately in the liver because of absence of very specific enzyme due to a mutation, and hence this disease goes from one generation to the other. So any person who has Wilson's disease, he has a chance of giving it to his siblings and also to his children by 25%. So we should remember that hepatitis in children have various causes. Some of them are just acquired, like hepatitis A and E, which is only and only spread by contaminated food and water. So if we continue to consume water which is contaminated or a food which is contaminated, like street food, junk food, foods which are not prepared hygienically, especially in the rainy season, every year thousands and thousands of children develop hepatitis A related liver disease, and unfortunately many of them lose their life as well. But if we are aware, if we can vaccinate our children with hepatitis A, we can save all these children. Apart from this, the government has already made universal screening of all the pregnant mothers for both hepatitis C and B. And in case any mother is found during pregnancy to have hepatitis B and C, we have strategies to make sure the transmission to the child is decreased so that the child does not develop any signs of hepatitis in future and we can save a liver. Thank you very much.